Guys, this is Mobeen. We are talking about the respiratory pathology and pneumonias. This is the last topic, or actually second last before the tuberculosis. In this topic, we'll do the miscellaneous pneumonia syndromes. And what that is we'll talk about nosocomial pneumonias, aspiration, and chronic pneumonias. Of course, for chronic pneumonias, then we'll talk more about tuberculosis in separate lecture. For these lectures, for this lecture actually, I would request you to listen to the first lecture for pneumonias, where we went in detail about the pathogenesis and the cellular events of the pneumonia. So I'm not going to redo the pathogenesis, that is just a waste of time. We will now see what are the pathogens and what are the specificities of various types of syndromes that are here. So let's start with the nosocomial. So the definition of the nosocomial pneumonia is pneumonia or the lung infection acquired during the course of stay at a hospital, and that is for the patients. So that is the nosocomial pneumonia, and it's a big problem. Why is it a big problem? For two reasons. Of course, it threatens the life and the well-being of the patients, and their recovery is slowed down. And secondly, it is a costly process. It is a costly thing. So keeping the hospitals clean, then keeping the infections at bay, then treating the patients that have developed those secondary pneumonias is a costly project. So that is a basic problem here. Now, what are the pathogens that are involved? So most of the times, of course, you must have heard MRSA or the methicillin resistant Staph aureus. So that is one of the very common one. But just know this, that gram-negative rods, enterobacteriaceae, Klebsiella, Serratia, and E. coli are common. Pseudomonas is common, burn victims and such. And then Staph aureus is common. Staph aureus also causes community-acquired pneumonias as well. So this guy works in both. In the community-acquired pneumonia, we talked about it, that patients who develop viral infections in atypical pneumonia can then have Staph aureus act as a secondary pathogen and cause bacterial pneumonia as well. So patient will go from atypical to typical. And Staph aureus, the problem with the Staph aureus is it is an aggressive pathogen. And in the hospital setting, it is mostly resistant to antibiotics as well. So it is dangerous. It causes cavitation, it causes necrosis, it causes lots of disruption of the lung tissue. Now, in the hospitals, there is a special case, and that is the patients who are on ventilators. So the ventilator tube can become the source. This tube looks like it is going through the head. It should be through the anyways. So the ventilator tube can actually become the source of the pneumonia as well. Such pneumonias are called ventilator associated pneumonias. Ventilator associated pneumonias. And these are, VAP are the most common type of nosocomial pneumonias in the hospitals. Normally these pneumonias occur to the patients who are severely debilitated or are immunocompromised or have some other long-term antibiotic therapy going on. They are more at risk of this. Now let's talk about the aspiration pneumonia. Please keep in mind that in these three types, this one is specific because of, this one is special, and you should remember this because of the Staph aureus plus the ventilator associated pneumonias. This one is important because of the abscess and necrotizing damage to the lung. And this one is important because of granuloma formations. So let's start here now, the aspiration pneumonias. Aspiration pneumonia is, of course, what it means is a patient aspirating the oropharyngeal, the contents in the mouth, which should be going to the either going out of the body or should be going to the stomach. These are aspirated in the airways and in the lungs. So now, what are the situations for the aspiration pneumonias? Number one, healthy people. About 10 to 20% of the healthy people can develop aspiration pneumonia because we all, when we sleep, we aspirate the oral, the saliva and the content in there. That's one, but less common here. Second, aspiration pneumonia is common in the comatose patients, that is the patients with stroke. Aspiration pneumonia is possible in patients with epilepsy. Aspiration pneumonia is possible in patients who are vomiting repeatedly. And then most importantly, that is something that you would see in the hospitals, and you would see that in the USMLE questions as well, aspiration pneumonia is related to alcoholic events. So alcoholics have a problem with their reflexes have become slow. So their gag reflex does not work correctly and they aspirate. Now, in addition to alcoholic, and the last group here that I want to talk about is the people with the neurological damage, where the reflexes are not properly coordinated anymore, or the nerves are severed, and so they are not able to deploy the reflexes correctly. In all such cases, it is possible that the content in the mouth and pharynx that would be going into the tracheal system or the airways, and it is also possible that the content that is regurged from the stomach and the esophagus is aspirated. Now, if it is the regurg of the content from the stomach, then I hope you realize, so let's say this is the esophagus and this is the trachea, the content went from here to here. What are the two types of pneumonias that can occur because of this? So let's say this is the trachea now, and here is the lung. So let's say this is the situation. What will happen when the aspirate comes in? First question, where will this aspirate go? What is the location of the aspiration pneumonia normally? Look, it is the right side. The same thing as a foreign body that lodges into the airways. Where does it go? Either it goes to the lower lobe or it goes to the posterior part of the middle lobe. So these are the areas on the right lobe, lower lobes or lower part of the middle lobe. That is where the aspirate normally goes as well. So when the aspiration goes there, the two types of pneumonias that can occur are chemical pneumonia, and that is because of irritant gastric juices, the irritating juices, acids from the stomach will come in and they would cause pneumonia. That is called chemical pneumonia. Or, of course, the oral flora that would come in and that would cause bacterial pneumonia. So the aspiration can cause both chemical and bacterial. Now, what are the bacteria? So look, it used to be thought that anaerobic pathogens are more common to cause the aspiration pneumonia than aerobic. However, the latest studies show that the aerobic bacteria are actually more common than anaerobic to cause the aspiration pneumonia. So what are the things? So these are the guys who lives in the mouth. So what are these? Haemophilus influenza. Okay, so what are the oral flora? So Haemophilus influenza is there, Staph aureus is there, Streptococcus pneumoniae, Pseudomonas. Then in anaerobic, bacteroids are there, Parvotella, Fusobacterium, and Pepto, Streptococcus. These are the pathogens that are present here and they can go in. Of course, some fungi are present here as well, so these can also go in. So that is or fungi. So that is the aspiration pneumonia. So now, what is the danger of this type of pneumonia, aspiration pneumonia? The most important thing is necrotizing tissue lesions. Necrotizing lesions. So necrosis occurs, that means cavitation would occur, that means even abscesses can be formed. So abscess formation, cavity formation, necrosis are all the risks of aspiration pneumonia, and especially in this, the Staph aureus is the one that would help create cavities. Cool. So now let's talk about the chronic pneumonias. All right. So now on the chronic pneumonias, this is something that we'll do in detail as well. The pathogens, the Mycobacterium tuberculosis and some fungi, we'll work on them separately too. However, over here, couple of things in this context that you should know. Number one, definition of the chronic pneumonia. Of course, it is a long-term infection which may or may not involve the lymph nodes and usually is granulomatous. So granulomas are involved and plus minus lymph nodes. So lymph nodes may or may not be involved. That is the definition of this type of pneumonia. Now, of course, the most important type to understand is the Mycobacterium tuberculosis related infections. We will do separate lecture about it. The second is some fungi, for example, candidiasis and cryptococcus and so on. These fungi can also cause the pneumonias. Now, just one statement here. Tuberculosis kills 6% of the world population yearly. 6% of the, not the world population, 6% of all the deaths, not the world population. 6% of the deaths occur because of the tuberculosis, and that also means tuberculosis or Mycobacterium tuberculosis is the most common cause of death by a single pathogen. There is no other one pathogen that when attacks us, infects us, will cause death other than this one. So that is the most common cause. 6% of the total deaths are done because of that. So we'll discuss that in detail later on.